Joining me now is Dr. Abdul El-Sayed. He was a former gubernatorial candidate in Michigan. He was a progressive in the race. He is a former Detroit health commissioner, and he's now the chair of Southpaw, Michigan. Abdul, welcome back to the show, brother.
Thanks for having me. Really excited to be with you.
All right, great to have you. So let's jump right in. So there's a conversation right now about whether Medicare for All would shut down all private insurance. So they asked Kamala Harris about it, and she says we don't need that. We'll see if she walks it back or not. Now all of a sudden, Cory Booker looks like he's wavering on whether it would get rid of private insurance or not. So let's clarify here. Would there be private insurance under Medicare for All?
So under the current bills that are being discussed, no. But the bigger question I think progressives need to be asking is not whether or not there would be private insurance. It's whether or not private insurance would be necessary. Because one of the biggest problems that we have in healthcare right now is that our entire system is predicated on people having access to these private insurance companies that have been colluding with big health systems, with pharma, with the AMA, to make sure that they're jacking up the costs and freezing a lot of people out. So I don't really care that private insurance becomes some luxury good that a few people can afford. I'm fine with that. It's that you shouldn't have to have it to be able to get health care in our society, or be poor enough to be able to get Medicaid, or old enough or disabled enough to get Medicare. So when we talk about Medicare for All, it cannot require people to have private insurance. And we're seeing people starting to obfuscate the debate, saying that we can have private insurance required and have Medicare for All too, and that's just not the case.
All right, it can't be required. That's absolutely clear. If someone wanted to get extra insurance, because whatever is covered under Medicare or under any insurance plan, you could always cover more, right? Would that be possible under Medicare for All?
Well, it depends on the bill, but we know that you could still call it Medicare for All and potentially have extra insurance that somebody wanted to get over the top. But the big question, again, that progressives need to be asking is, does the plan require private health insurance? And any Medicare for All plan that's worth its salt, that's real Medicare for All, will not require it. People will be able to get access to healthcare at the point of care, free of charge, without having to have any sort of private coverage, and get high quality care, not the second tier stuff that so many people on Medicaid get.
So Abdul, the conservatives then say, well, then I might lose my private insurance, and I like my private insurance. How do you answer that?
Well, look, at the end of the day, the fact that you have private insurance is the reason why we pay 19 cents on the dollar for every dollar spent on an entire economy on healthcare. It's the reason why these big insurers are colluding with these big hospital systems to freeze out poor and working people in low-income communities, be they urban or be they rural. That private health insurance system is the reason these big CEOs make $13 million a year on our backs, money that we're paying. We can have more equitable, more accessible, more affordable healthcare without having a requirement to have private insurance. And what we saw in the ACA, unfortunately, is that it built this new reform on the backs of, in effect, cementing in the private health insurance industry. We need structural change, Medicare for All, that does not require people to have private insurance, that moves them out of the structure of our healthcare system entirely, and make sure that everybody, no matter who you are, doesn't matter if you're homeless, doesn't matter if you are the president of the United States, that you will get the same quality care, and that doctors will take your insurance, because it is the single publicly funded Medicare for All based insurance system.
So before I move on to Medicare for Some and the new proposals by the establishment, so I want to just be absolutely clear. So I wouldn't need private insurance, and correct me where I'm wrong, because I'd have no deductible, I'd have no copay, I'd have no lifetime limits, and it covers all the way in. If you take, for example, Senator Sanders' version, it covers dental, vision, so you get all the same. In fact, you'll almost certainly have better coverage than the private insurance that you have now, and you'll pay nothing.
That's right. Most people, when they talk about liking their health insurance, they haven't actually had to use it, right? Fortunately, most of us are healthy. I hope it always stays that way. But the problem is that when you start to try and use it, you realize that you're going to have to pay above and beyond what you're already paying in monthly premium. You're having to pay a deductible, right? And you're having to worry about whether or not you're getting free care at the point of service, i.e. a copay. And most people don't like having to pay for those things and having to fight their health insurance system. And so most people don't actually like it if they actually have to use it. And so in this system, Medicare for All would provide free care at the point of care that covers necessary medical care, including vision, including dental, including mental health care. That's not really covered by a lot of private insurance right now, and allows you to do that without having to pay at the point of care, without having to worry about whether you hit your deductible, without having to worry about whether you've hit a lifetime limit, and certainly without having to worry about having pre-existing conditions. This is the way we need to go in this country to make sure that the 5 to 10% of people who don't have health care as it stands are not frozen out of a system that we know does not provide them the human right to health care that everybody deserves.
We're talking to Dr. Abdul El-Sayed. He was a physician, obviously, and a former Detroit health commissioner, and ran for governor of Michigan. So what is Medicare for Some? So this is the first time hearing of it. It has a wonderfully comical name, but what does it mean?
Well, I'll tell you, look, people are realizing how popular Medicare for All is. It's polling 60 to 70% depending upon the poll that you're looking at. And a lot of folks who are cozy with the insurance industry are thinking, well, how can we have our cake and eat it too? How can we make sure that these health insurers that, by the way, are big donors to Democratic and Republican campaigns, how do we keep them happy? And so they're taking the name Medicare for All and they're putting extra stuff in it. One plan that's pushed forward by the Center for American Progress is called Medicare Extra for All. And you'd think that if it's Medicare Extra, it'd be better than Medicare, right? Because it's extra. That's not the case at all. What it does, in effect, is brings back the idea of the public option. If you think back to the time when we were debating the Affordable Care Act, there was a question about the public option and ended up getting stripped. The Obama administration couldn't push that through. What Medicare Extra for All is in effect a public option. It allows you to buy into Medicare if you're a company or if you're an individual. Here's the problem, though, that keeps us with Medicare for Some, because of course some people aren't going to be able to afford it. The big problem we have in our society right now is that Medicaid covers folks who make up to 133% of poverty, which is not very much at all. And then after that, there's this big donut hole between when the people can actually have access because they can afford healthcare on the exchanges, and then of course there's Medicare for people over the age of 65. Medicare Extra is not going to really solve that problem. All it does is introduce a competitive, publicly funded or publicly subsidized public option, and that's not enough. We need to make sure that anything that we call Medicare for All implies that it covers everybody. You shouldn't have to buy in. You shouldn't have to worry about whether or not your employer got it. You shouldn't have to worry about how much money you make or whether or not you can afford it, that you will get health care when you need it at the point of care without having to pay a dime, that will cover all of your basic health care needs.
So is the public option marginally better than what we have now? Or does it have some portions of it that are counterproductive that make that equation a little bit harder to ascertain if it's a net positive?
So to be fair, it is better than what we have right now. Unfortunately, right now, 5 to 10% of people don't have access to health care. I think a public option is something that would hold some of the health insurers accountable. It would provide health care to more people. So if it's between where we are and that, I'd pick that. Here's the problem, though. We are talking about the potential for comprehensive structural healthcare reform when we talk about Medicare for All. When people want to water it down and say Medicare Extra or Medicare Advantage or Medicare, you name it, what they're trying to do is water down the idea of a structural, fundamental difference in the way that we do healthcare. It says that basically we can go incrementally toward Medicare for All, but we can't really get all the way there. And we know that it's time for us to get all the way there. It shouldn't matter how much money you make, shouldn't matter how much you can afford. You should be able to have health care at the point of care, free of charge, that covers your health care needs just like anybody else. Medicare for All, real Medicare for All, does that. These other plans, their goal in effect is to just get us incrementally closer. We know we can get all the way there. There's a pathway forward if we have the political will and the political courage.
So Abdul, Medicare Extra, would it theoretically have deductibles, co-pays, et cetera? Because we still have a private system in place under that plan.
That's the problem, right? The fear that I have is that when you start offering these plans that people buy, the question then becomes, well, how do they become implemented? And unfortunately, we're seeing a privatization of Medicare as it stands under these Medicare Advantage plans. If you look at where Donald Trump is headed right now, his goal is to really transfer Medicare as it stands, public Medicare, into a private system under Medicare Advantage. And I worry a lot about whether or not this Medicare Extra would in effect be Medicare Advantage, which is just saying that you're buying into a quote unquote public system that in the end is operated by a private health insurer. And so I worry a lot about what that looks like. My point is that We cannot allow this conversation to keep getting watered down. We're talking about a publicly funded Medicare for All program. That's all we should be talking about. Anybody trying to water it down probably has ulterior motives as to why they're doing it. And we've got to stand up and protect healthcare for everybody against the impact of big insurance that really just wants to profiteer off of us and make a buck off of what happens when we get sick. And that's just not right.
So last thing here, just because I want to be clear, and we're really short on time, but if you have just the Medicare Extra for All, it's not Medicare for everybody. And so you're not going to get the economies of scale. You're not going to get the cost savings of removing private insurance out. You're still going to have some of the same, or a lot of the same frustrations that are in this current system, but it might then be blamed on something called Medicare Extra for All.
Yeah, that's the worry right now. We know Medicare for All is so popular because people get the basic idea. It's Medicare for everybody. Medicare Extra won't be Medicare for everybody. It'll be, like you said, Medicare for some. And it's not going to deliver on the promise of Medicare for All. So there's a real political challenge there. And like you said, look, the reason Medicare for All matters so much is because it breaks the kind of collusion power that big insurance has with big healthcare. And if we just had another private system or Medicare for some, it's not going to do that. So we're not going to get the major cost savings. We're going to miss out on being able to provide healthcare for everybody. And I worry about the political costs of saying we have a reform, gets watered down, and then people end up just like where we are right now with the ACA saying, well, you said you were going to give me all these things, and I didn't get them. So we've got to stand up and say, no, Medicare for All means Medicare for everybody. It means it covers everybody, no matter how much they can afford. And it breaks the kind of collusion power that we're seeing between big insurance and big healthcare that jacks up the cost for all of us, delivers us mediocre quality healthcare that's the most expensive in the entire world.
All right, if you want to find out more, AbdulEl-Sayed.com, and also check out Southpaw, Michigan, and obviously Dr. El-Sayed is a great expert on this. Thank you for joining us, really appreciate it.
Thanks for having me, I appreciate you covering this important issue.
Thanks for watching this free clip of the Young Turks. Don't forget to become a TYT member today. For more exclusive content, join now at tyt.com/join.